friends, welcome back to my another video. In today's video we are going to talk about the nursing ethics. Now in today's video we have the new topic which is the nursing ethics. In previous class we have taken two videos to complete the nursing care and nursing knowledge, nursing process. We have done with the nursing process. Now in this video we are going to learn about the nursing ethics. So firstly we will talk about the definition of the nursing ethics, means what is the nursing ethics. First Before getting started, subscribe to my channel and share to my video to your friends, and don't forget to like my video. Now let's get started with it. Definition of the nursing ethics. What is the nursing ethics? Nursing ethics means it refers to the moral principle and values that are governed in the nursing practice, and it get ensured that the care is delivered with compassion and respect and accountability. Now, what is the definition of it? Nursing ethic means it refers to the moral principles, means principles and moral principles means due to from the use of case studies and all, it get referred with it, and values of the governed nursing perspective ensured care means the things which are the govern in the nursing practice, means what nurses get practiced means the nurses has practiced the ensured care with the well-being and integrity and well-being care to the patient they gives, and they feels like and relatives to the patients, and they be very lovely and kind and respect and accountability and compassionate if with the patients. Like this, the nursing ethics is there. Now, I have told you in the nursing process that the nurses are the well-being and well-being patient needs knower, means they knows the needs of the patient in well-being and mannerful way. Like this, the nursing ethics also explain the more deep about the care of the nurses. Now, I hope you understand what are the nursing ethics. Now, core the nursing also has core principles, like it includes autonomy means respecting patient choices, means the choices the which the patient has, and doing good with them, and being non-maleficent means non being avoiding harm, and being kind with the old person or kid with the kid, or the or young person is there also, young person's kid is there, or children is there, or woman or man is there. They be very beneficent, and they avoid harm, and they be as a justice and fairness with fidelity, and they keep the promises and veracity of the truth telling, means they tells all time the truth, and they are very truthful and very faithful with the patients. Now, I hope you understand what is the nursing ethics. Let's talk about the key of the principles. Now, what is the principle? What are the principle and what is the principle? Principle means there are four things which are the four things with the nurses keeps in their minds, which are the main things to give a well-being patient care to the well-being care to the patients. Firstly, autonomy, autonomy. And then second one is beneficence, beneficence. Then third one is non-maleficence. Then fourth one is justice. Now, what are this all? This all are the four things, means the steps which takes the which the nurses takes. Okay. Now, first, what is the autonomy? Autonomy means they honors the patient self determination, means they honors the patient needs, and they gives the respect to the patient needs, and they be very kind and faithful with them, and they give an self-determinated care to the patients. Firstly, then in beneficence means actively promoting promoting patient welfare. Now, what is beneficence? Beneficence means actively promoting the patient welfare. Means they promotes the patient welfare, and they do a very promoted and very well well doing work with the patients, and they be active with them, and they talk kind softly with them, and they promotes the patient welfare. Now, what is the non-maleficence? What is non-maleficence? Means they do not harms, and in all actions they do not harms, and they be very quiet and very kind with the patients, and they respects the needs of the patient in non-maleficence, and they doesn't judge the whether is their kid a child, or whether there is a young guy or a girl, or whether there is a old man or woman. They don't judge. They in all actions they don't harm them. They talks very smooth and very kind with them, and they be very mannerful and disciplined with them, and they give very well-being patient care to them. Now, what is justice in this? Justice in this all. Justice means they ensure the equitable and care distributions. Means now in previous classes we have talked about the sequential steps. In sequential steps, you can see that in the diagnosis, you can remember that we are talking about the diagnosis. In diagnosis, we have in diagnosis we have learned about that the patient they knows the patient needs. Firstly, they knows the what is the disease, from how many times the patient is suffering from that, and what food the patient usually eat in their homes, and how many person lives there, and how many what is the temperature of the area, and what is the degree of the area, and how the patient sleeps, do the patient does exercises, what exercise patient does, and what patient takes, what budget the patient has. They knows in this diagnosis. After that, they implement. In implementation, I have told you that they implement of all outcomes, when outcomes of the all data, when the outcome of the da- when the data gives the outcomes of the all things, then they implement in the implementation. Now, what is the care distribution? Like in the planning, means in planning we have seen that the nurses gives an equitable and etiological their care distributions. Means like if the patient is disabled from the hand, so they will give an comfortable chair, and they give water to them, and some food to them, and they give medicine tablets, medicine in and good amount, which how much an amount the patient has to be needed, and the patient tablets and the patient which vaccine the patient needed. This all they knows in our nor justice. So like this, the justice, autonomy, beneficence, and non-maleficence works. I hope you understand what are the this all things which we have taught in our nursing ethics. This was our one video. We have to make a one more part, which is will be the part two of this video, in which we will explain the what is the all nursing ethics left at part, which we will explain in that video. So I hope you understand what is the nursing ethics, how the nurses give the care to the patient, what are the principles of the patient, how many principles of the patients are principles are there, and what are they, like autonomy, beneficence, non-maleficence, justice, what are they and what they do. I have all explained you in this video. For watching my previous video, you can go and watch in my channel, which is the nursing process. Two videos I have making on that, so you can go and revise and learn about them also. Thanks for watching my video. Bye bye.